I am an outreach worker working with MinFen in the Haverhill area, and I got into it several years ago. I graduated with a degree in psychology from Westchester University in Pennsylvania, and I originally started working with children and eventually transitioned to working with adults with mental illness. I love my job. Absolutely love my job. I love helping people. I love it when they get that spark of that click, that all the puzzles, the pieces of the puzzles click and they fall into place, and that spark of recognition clicks in, and it's just, that's what makes my day. That is recovery. There's not a huge salary. You know, I have a 4-year degree, but I don't always feel like I have a lot to show for it, other than I taught somebody how to dust the other day, or I taught them how to go grocery shopping, even though it took me 6 months to do it. My husband is being deployed to Iraq from today, September 21st. And he'll be gone for, his orders are cut for 400 days. We have 4 children to take care of and feed and clothe. You know, we're living in my parents' house right now, and I can't even, that doesn't make me feel, makes me feel less of a mother, that I can't provide for them. The only way right now that we're being able to even supply decent health insurance is because my husband is on active duty and he's eligible for TRICARE under active duty with the government. That's it. That's the only way. When he comes back, we're not really sure what we're going to do. And I would ask, how are they going to ensure that people like me and people like him can continue to help and aid the people that we serve while still being able to care for our own families?
Mandated to have health insurance, thousands of direct care workers cannot afford their employer's coverage and are ineligible for the Commonwealth Connector. How will you help Claire and other families like hers? Jill Stein will have you respond.
Yes, thank you. And this is obviously a critical issue for many of what we would have to call the working poor here. Should be the working middle class, but effectively they've become the working poor. And so many in human services, construction workers, small business people, I have been absolutely devastated by the Massachusetts health reform. And yes, there is indeed, you know, it's a wonderful intent and gesture to expand health care. But we know well there are other ways to do that don't put an unbearable price on a major sector of the population. You know, our families that don't have generous wages, who cannot afford the mandate. And furthermore, there are holes in these policies that people are being forced to buy. So even if they can afford them, they are not protected. And people are walking around with as much medical debt as they were before we had this reform. Not to mention that the price is absolutely skyrocketing. Healthcare now consumes 50% of our state tax dollars. It's 1/2 of the state budget. It's absolutely staggering. So that to me is why we need to really step up to the plate here and implement the one reform which we know works. This is essentially a Medicare for all type system. It's like the public option that was suppressed during the national discussion. We can have it here and save a lot of money with your health care reform.
Thank you. Charlie, thank you.
Claire, you here? Thank you to you and your husband for your service to this country. I would suggest a couple of things. I think one of the ideas that the Treasurer mentioned previously, which has been discussed in the legislature, about giving provider organizations the ability to buy into the group insurance commission, given the amount of connectivity that already exists between the provider community and the state, is an idea that should be pursued. I think there are a lot of possibilities there. The second one is the legislation that was passed earlier this year does give the provider community the ability to create sort of an association-type purchasing collaborative, which I think for a lot of particularly smaller provider organizations would be a big improvement over where they are now. But I said for a long time that I think one of the things we have to do if we want to create real urgency and focus around the cost of serious about publicly disclosing what people get paid and how they perform. Because within 20 minutes of this building, I could go have the same service provided in 4 different places with the same outcome, and the price of that service would vary by as much as 500%. And if you then add in the difference between what the public programs pay and what the private programs pay, the price of the service could vary by as much as 600%. And there's simply no way we will ever get our arms around what to do about the cost of health care until we create a public discussion and public accountability around the differentials that exist. If one person's getting $200 and somebody else is getting $1,000 and they're doing the same thing, we need to reward and celebrate the person who does it for $200 and really put the light on and the arm on the person who's doing it for $1,000. We truly want to get to where we need to go on healthcare costs.
Yeah, I think this question is broader than the Providers Council and the providers. I mean, it affects all middle-class people. Too wealthy to get subsidization, but certainly not anywhere near wealthy enough to pay for the cost of the rising cost of health care. Wait till those 4 children become college age, and then you realize you're in the same squeeze when it comes to educating your children. We need to lessen the amount of mandates. There are too many mandates that are required in the healthcare reform legislation. We need more competition among health insurers. There's no reason why we can't buy health insurance both within and outside of state lines. We need tort reform. Neither state or federal government has even addressed the issue of whether or not we have medical malpractice insurance reform. It is driving up the cost of health care, clearly driving up the cost of health care. What I'd like to suggest is health administrative courts, so we can bring the disputes amongst the medical community and patients together to solve the problem, to still give people their rights, but not to lead doctors to leave the state. And we have to encourage and incent communities and incent businesses and incent individuals to take limited networks. You can't have it all. This healthcare reform laws that was passed in 2006 has done one thing well, which has created access opportunity for mandated access. Nothing else is working in my mind. We're paying too much, we're losing doctors, people are still going to emergency rooms. We must fix the problem now, or so many families are going to be caught in that squeeze as we go forward. Yours, your mine, and everyone's.
Patrick?
Thank you. Claire, thank you for the question. And just to be clear, healthcare reform is not the reason prices have been escalating. This is a national problem. The reason prices are escalating is complicated, but it has as much as anything to do with health insurance companies that are raising premiums double digits every single year, mainly on small businesses. And of all of us here, and by the way, we agree on many of the solutions here, but of all of us here, I'm the one who's actually done something about it. We capped the premium increases in the spring this year. A new bill that permits small businesses, of which many providers are, to aggregate and buy together. Providers ought to have an opportunity through that to manage their costs down. Something called payment reform, which is maybe too much in the weeds, but it's really moving away from paying for the amount of health care to moving to medical home quality of care as a strategy that has been recommended. To me, it makes a lot of sense. It's a big change, but it's a big change is what we need. And above all, I don't think we ought to be walking away from the objective of making care uniformly and universally available to everyone, to you, to your family members, to the aged, to the young, and everybody else, because health is a public good. And I think we've done a lot there in terms of access with 98% of our residents with insurance today. Now we've got to work on getting the cost down. We've got the strategy.
Thank you, Governor Patrick.